Picture it. It's 1923 and you are having the worst day of your life. You have just gotten married, and on your wedding night, you and your new spouse consummate the marriage. The next morning, you wake up and boom, your brand new spouse is dead. What do? Simple. You sue their family for murdering them during the night. And really, this is not that far-fetched of an idea given the medical knowledge of the time. The way people died in the past was wild. People could die from getting married. Now, there were obviously other ways to die. For example, being stabbed to death by an angry mob was pretty common in the Middle Ages, but even that had nothing on the medical practices of the time. Welcome back to the channel. Today, we're taking a look at the most insane medical practices from the past. Make sure to let us know what you think about these in the comments below. And if you're new here, make sure to subscribe so you don't miss any awesome videos. Doctors used to routinely share instruments between patients without sterilizing them. This led to all sorts of horrible infections and diseases. But hey, it wasn't like they knew any better. Doctors would often share needles when giving injections, which would lead to patients contracting HIV and hepatitis C. Yikes. Blood transfusions were also a common practice in the early days of medicine. And guess how they would get the blood for the transfusions? By draining the blood from healthy patients. The worst part is that they didn't even use the drained blood for the sick patient. Instead, they would use it to treat other ailments. So basically, they were just spreading diseases around. No thanks. Trepanation was a common practice in which a hole was drilled into the skull. It was done to relieve pressure on the brain or to treat headaches. Can you imagine the pain that must have caused? These days, we have advanced technology that allows us to perform these procedures much more safely. But back then, it was done with a simple drill and a lot of pain. Now here's one for the gross-out factor. Doctors used to stick their fingers into wounds to feel around for the cause of the pain. They would also use their fingers to control bleeding, which meant that they were often covered in blood and other bodily fluids. Talk about a nightmare scenario. Enemas were also a popular medical treatment in the past, and doctors would often administer them without gloves or masks. They would also use the same enema for multiple patients, which, well, that just sounds nasty. And let's not forget about the good old days of lobotomies. Lobotomies were performed with a procedure called ice pick lobotomy, which involved inserting an instrument into the brain and then twisting it around. The goal was to damage a part of the brain that was responsible for mental illness. Needless to say, many patients did not survive the procedure. But wait, it gets worse. Doctors used to perform these procedures without anesthesia, meaning that the patients were wide awake and feeling all the pain. Imagine that. There was also something called heroic medicine, which involved giving patients large doses of medicine in order to cure them of their ailments. The problem was that many of these medicines were toxic and would end up killing the patients. Then there was the Salem witch trials, which were based on the belief that witches were causing people to become ill. The so-called witches were then tortured in order to extract confessions from them. Many innocent people were killed as a result. Doctors used to perform autopsies without telling the family, and they would often sell the organs to medical schools. The families were understandably upset when they found out, and it led to a lot of distrust between doctors and patients. So yeah, those were some of the grossest medical practices from the past. Let us know in the comments below if you think there should be a part 2 to this video. We hope you enjoyed this video. If you did, please like and subscribe. And remember, stay happy and healthy.